In June 2023, President-elect Trump gave a speech outlining his stance on gender-affirming care and the measures he will take to protect our children from left-wing insanity, in his words. I will link the original YouTube video in the description, and we will examine his plans in depth regarding the transgender movement and agenda. The plan is designed to protect our children immediately upon enactment, perhaps even sooner as medical facilities prepare for the impending changes. It is important to understand that nothing Trump said in this speech would stop consenting adults from receiving gender-affirming care. This is important information for transgender patients to understand. This agenda could protect children from being talked into a transition that could cause them a lifetime of medical problems. For the YouTube censors, this information is based on medical studies in respected journals. The side effects of gender-affirming drugs are based on required physician inserts created by a drug manufacturer and attached to every prescription drugs bottle purchased through legitimate channels. So let's take a look. Don't forget to share, like, and subscribe, and if you are able and would like to help with the expenses of the channel, I am always grateful for a tip or super thanks under the 3 dots below the video. Remember that the Hippocratic Oath requires that physicians first do no harm. I'm sure you've heard this. It is an oath or promise. In practice, it is often more complicated and comes down to weighing the risks versus the benefits. So we must first look at the potential harm to those who receive medical gender-affirming care at any age. Then we will look at what it does specifically to children or minors. In general, medical transition involves using hormones, like estrogen or testosterone, and puberty blockers, which can have a range of potential side effects. Unfortunately, people have become so dependent on prescription drugs that they believe that if a doctor prescribes a drug, then it's safe. In over 40 years of being a pharmacist, I have never seen any drug that is completely free of side effects, and messing with one's hormones can be especially harmful. Much more so than a Tylenol or cold medication. They can change the body for life. So let's take a look at the basic 2 drug therapies that are used to transition one's sex. Puberty blockers or GnRH agonists, gonadotropin-releasing hormone agonists, are medications that delay puberty by suppressing sex hormones, often prescribed to youth experiencing gender dysphoria today. Bone mineral density reduction is a common side effect of these drugs, which increases the risk of osteoporosis later in life. Puberty blockers can also irreversibly stunt growth when started at an early stage of puberty. A common side effect is emotional effects. Many individuals report mood changes, anxiety, and depression. One of the main arguments from supporters is that transitioning decreases suicide, but the very drugs used can increase mental disorders which can lead to suicide. Delayed puberty impacts fertility. This untoward effect of puberty blockers is generally considered reversible upon stopping the medication, but the long-term effects are not yet fully understood. So if your minor child is on puberty blockers for transition, there is hope of regaining fertility upon stopping. But of course, the less time they are on them, the better the chances. Also, the chance of regaining fertility is decreased if cross-sex hormones are introduced after the use of puberty blockers, so unnecessary use of puberty blockers should never be considered in minors because you could be committing your child to a life of never being able to have their own children. That was puberty blockers. Now let's look at cross-sex hormones such as estrogens or testosterones, which are being used to develop secondary sex characteristics of the gender that they are transitioning to. For estrogens, which are used in male-to-female transition, listen to the potential side effects that minors and adults can experience. First, there are serious cardiovascular risks, such as increased risk of blood clots, stroke, and high blood pressure. As a pharmacist, I just can't imagine why any parent would subject their child to such risks. Next, there is the potential for liver enzyme changes. Estrogen therapy can elevate liver enzymes, indicating potential liver stress, and may sometimes cause cholestasis, a condition where bile flow is reduced, leading to symptoms like jaundice and abdominal pain. Breast tissue development may be permanent in males, and long-term estrogen use may lead to irreversible infertility. Again, estrogens also cause emotional effects, including mood swings and changes in libido. An increased risk of bone density loss occurs when used alone without androgen suppression. Now, let's look at the use of testosterone, which is used in female-to-male transition. Testosterone also causes elevated risks of high cholesterol, high blood pressure, and higher cardiovascular disease risk. They also cause a blood disorder known as polycythemia, which is an increase in red blood cell count, which can thicken the blood and increase stroke risk. Increased oil production leads to acne and growth of facial and body hair, which may be permanent should a female choose to detransition. Permanent lowering of the voice is very common, and so is permanent growth of the clitoris. Mood swings, increased aggression, and changes in libido is very common. You may have heard the term roid rage. This is the aggression that is clearly caused by the use of testosterone. Use of testosterone also contributes to irreversible infertility, especially with long-term use. While transitioning can improve gender dysphoria for some, it does not always address underlying mental health issues, and further mental health care is often necessary. Many effects, especially with long-term use starting in adolescence, are not yet fully understood due to limited long-term studies. These side effects can vary widely between individuals, and close monitoring by healthcare professionals is typically recommended. In a nutshell, puberty blockers and cross-gender hormones can have debilitating side effects that are irreversible. While drugs related to transition can cause life-changing effects, the sex change surgeries, also referred to as gender-affirming surgeries, can involve different procedures such as mastectomy, genital reconstruction, vaginoplasty or phalloplasty, and facial surgeries. These surgeries carry significant risks and potential side effects inherent in many surgeries, particularly when performed on minors, whose bodies are still developing. Let's take a look. General risks of gender-affirming surgeries are similar to all surgery, including anesthesia risks, post-surgical infections. All surgeries create scars, which might not heal as expected. In some cases, hypertrophic or keloid scars can form, leading to aesthetic or functional concerns. General surgery risks include blood clots known as deep vein thrombosis or pulmonary embolism, which can be life-threatening if not detected and treated promptly. Some patients may experience poor wound healing due to factors like smoking, diabetes, or other health conditions, which could lead to complications. Certain surgeries, especially those involving genital reconstruction, may lead to changes in sensitivity or numbness in the operated areas. This can impact sexual function. A risk associated with surgeries like phalloplasty or penile implants, where tissue pressure increases, affects blood flow, causing pain, swelling, and muscle damage. Some individuals may experience regret or dissatisfaction with the results, especially if expectations are not met. As the number of such surgeries have increased, so do the number of people who seek to detransition. Before examining President Trump's upcoming policies, let's quickly address the risks for the various surgeries. A mastectomy or chest reconstruction can cause partial or complete loss of feeling in the nipples, which may affect sexual sensation and body image. There can also be problems with asymmetry or unsatisfactory aesthetic outcomes, leading to the need for corrective surgery. Vaginoplasty can cause difficulty urinating or a need for catheterization due to surgical alterations to the urethra. If you've ever been catheterized, you understand the pain and disability associated with long-term catheterization. Most patients experience vaginal stenosis, requiring dilation or revision surgery. After vaginoplasty, patients are advised to start dilation therapy within a few days of surgery, which involves inserting a medical-grade dilator into the newly constructed vaginal canal to maintain its width. Think about a deep hole is made in your body. The miracle of the body is to close that hole. Vaginoplasty starts with smaller dilators and gradually increase the size over time as the vaginal canal heals. This dilation procedure has been described as painful by many transitioners. During the initial healing phase, usually the first 6 months, patients may need to dilate multiple times a day. After this period, the frequency can often be reduced, but ongoing dilation is recommended for at least 2 years and is sometimes necessary for the rest of one's life. Another side effect of penile inversion vaginoplasty is the loss of orgasmic function. About 30% of patients lose the ability to experience orgasm due to nerve damage or other surgical complications. This is a significant number to consider before such a serious decision. The age at which an individual undergoes medical transition can significantly impact the level of risk associated with the treatment. Transitioning at a younger age can pose unique risks due to the effects on development, long-term health, and psychosocial factors. In addition to all of the side effects above, adolescents are especially subject to changes in cognitive and emotional development. Puberty is a critical period for emotional and cognitive development, including areas like risk assessment, decision-making, and social skills. Puberty blockers and cross-sex hormones are well known to cross the blood-brain barrier, which can have unknown effects on brain development, though studies on this are limited. People should understand that limited studies does not mean they are safe. It means that drug companies and other institutions have not spent the money to find out. During this announcement, Trump outlines an initiative that attacks the problem of transgender grooming and mutilation in our youth from numerous angles. In my opinion, it preserves the rights of transgender adults while providing method to halt all efforts to manipulate and victimize children with unnatural and life-altering mutilation of minors. Let me repeat that this is only my opinion. You should watch the video and form your own. The first thing Trump will do is sign an executive order that will stop all programs that promote gender transition at any age. This means that there will be no programs promoting transitions to anyone of any age. These fame-seeking transgender child groomers sneaking into your children's phones will be removed. One might say this is freedom of speech, but once the order prohibiting it becomes effective, it's no longer free speech. There are limits when it comes to speech. If something is specifically inducing others to commit a crime, then it's outside those limits. So if people can be censored on online platforms for not doing anything illegal, I would think that Trump could definitely censor child groomers if he makes it illegal. The key legal concept here is incitement. According to a 1969 U.S. Supreme Court decision in Brandenburg v. Ohio, speech can only be restricted if it meets two conditions. It incites imminent lawless action, and it is likely to produce such action. So if someone is directly encouraging or persuading others to break the law, such actions are not covered by the right to free speech and can lead to criminal charges such as aiding and abetting or solicitation of a crime. I think all working people are going to like this next Trump request. Trump said that he is going to ask Congress to permanently stop federal taxpayer dollars from promoting or paying for these procedures. That means no more paying for people's gender-affirming care from the taxpayers of the country. Any adult could still have gender-affirming care. They just need to pay for it themselves, just like cosmetic surgery. So don't believe the misinformation that Trump is banning gender-affirming care. The reason President Trump must ask Congress to make this change is because a president can't use an executive order to directly make spending decisions related to allocation of funds or the creation of new spending programs. Only Congress can actually allocate and approve federal spending through the appropriation process. As I've said before, there is no magic wand. It appears that we are going to take back our country legally and without force, the democratic way. It looks like Trump could have a Republican majority in both the House and the Senate, which should assure that things go smoothly. However, he can write an executive order that directs how existing funds are used or how spending priorities are set within the framework of current appropriations. So it sounds like he can stop existing funds from paying for surgeries and drugs. Trump also said that we will pass a law prohibiting child mutilation in all 50 states. This is very different from the way the Supreme Court gave the authority to decide about abortion to the states. This will prohibit hormones and gender blockers for minors under 18 years old across the country. Making this law is one thing, but enforcing it is something completely different, and the way Trump is going to enforce it is ingenious and will work. So how is he going to make sure that no more of this disfiguring surgeries occur to children? The answer is to hit them in their pocketbooks. Most hospitals and healthcare facilities cannot exist without federal funding, and they must pass accreditation to receive that Medicare and Medicaid money. I remember when I worked in hospitals. The entire hospital would always go into panic mode when we were due for an inspection by the Joint Commission on Accreditation of Healthcare Organizations, or JCAHO. There are about 6,093 hospitals in the U.S., and about 65% of U.S. hospitals are accredited by the Joint Commission. It's important to note that while the Joint Commission is a prominent accrediting body, other organizations also provide hospital accreditation. Therefore, some hospitals may be accredited by different entities or may not seek accreditation at all. In addition to accreditation, hospitals and clinics rely heavily on Medicare and Medicaid for their revenue. Specifically, Medicare payments contributed to 18.9% of all hospital net revenue, while Medicaid payments made up 13.5%. Combined, these programs represent approximately 32.4% of hospital net revenue. Doctors also rely on Medicare and Medicaid, and approximately 93% of non-pediatric primary care physicians accept Medicare patients, and 70% of office-based physicians accept new Medicaid patients. So that's a lot of physicians that rely on these government funds. This dependency underscores the critical role that Medicare and Medicaid play in the financial health of the industrial medical complex across the country. This is how Trump is going to stop the transgender surgeries, hormones, and puberty blockers. Trump has said that any hospital or healthcare provider that participates in the chemical or physical mutilation of minor youth will no longer meet federal health and safety standards for Medicaid and Medicare and will be terminated from the program immediately. Immediately, guys, no 5-year phase-in. They must stop the mutilation of our children immediately. That means a doctor or other healthcare provider who prescribes hormones or puberty blockers to a minor will lose their Medicaid or Medicare approval for all services. You will hear the misinformation about this, but understand that a healthcare provider can continue to receive Medicare and Medicaid reimbursement if they perform such gender-affirming treatment on adults. So Trump does not intend to ban all gender-affirming care just on minors. But the taxpayers will not be paying for that adult treatment, so they are going to have to pay for it themselves or through a private insurance. Pretty brilliant, in my opinion. Next, Trump will support the creation of a private right of action for victims to sue doctors who have performed these procedures on minor children. This is amazing. Any minor that receives such treatments can sue the physicians who did it. I interpret this as meaning that even if there has been no long-term damage, minors could sue, but we will need clarification. It would not surprise me if these rights extended to the right to sue hospitals for such damages as well. Again, adults who received such procedures will still have to prove some sort of negligence or damages such as permanent sterility. But I'm assuming that anyone having such treatment has signed a consent form clearly stating the risks. The deal here is that minors cannot consent legally. Trump is also out to hold Big Pharma liable for gender-affirming care. He did not limit this to minors in his language. He said, "The Department of Justice will investigate Big Pharma to determine if they have deliberately covered up long-term side effects of sex transitions in order to get rich at the expense of vulnerable patients." This could also be huge because qualified healthcare providers know or should know the long-term side effects of the drugs used for gender transition. This tells me that there could be severe penalties for drug companies who promoted this to practitioners or any aged patient without full disclosure of the side effects. Such a determination could open the floodgates of lawsuits against Big Pharma for gender transitions as well as for COVID vaccines, as mentioned in my last video, which will be linked at the end. Could this be the end of Big Pharma? What are your thoughts on how President-elect Trump intends to attack the transgender agenda, which many believe is harming and sterilizing our children? Even better, Trump has said that we will also investigate whether Big Pharma or others have illegally marketed hormones and puberty blockers, which are in no way licensed or approved for this use. This addresses arguments how physicians have been prescribing hormones and puberty blockers as part of gender-affirming treatment. Off-label use refers to the practice of using a medication for a purpose, age group, dosage, or route of administration that has not been approved by the FDA. If you remember a while back, the media was going after doctors for using ivermectin for COVID-19, denying their right to prescribe ivermectin under the off-label use provisions. I don't believe that the right to prescribe off-label should be taken away from physicians for all drugs, but the hormones and puberty blockers are causing significant long-term damage. So that you understand, physicians are legally allowed to prescribe drugs off-label based on their medical judgment and knowledge of the drug's effects. They may occur under several conditions. A doctor can prescribe off-label if there is credible evidence or clinical experience supporting the off-label use, or if there is a lack of approved treatment options for a particular condition. And lastly, they can prescribe off-label if other approved treatments have not been effective or have caused side effects. Let's dig a little deeper. GnRH analogs are approved by the FDA to treat children who experience puberty at an unusually early age, a condition known as precocious puberty. However, they are not approved to delay puberty to treat gender dysphoria in otherwise healthy minors. Now let's look at those allegedly harmless hormones. First, testosterone, which is commonly prescribed to girls to exhibit male traits. The FDA has approved certain testosterone formulations for use in males under 18 years of age. Specifically, testosterone enanthate is approved for treating conditions such as delayed puberty in males. So this particular testosterone form can be prescribed only in males, which will make them exhibit male traits such as hair growth, etc. And again, only if the child's puberty has been delayed by nature. But what about estrogens, or female hormones, which are commonly used by males to transition to females? They can cause gynecomastia, or breast enlargement, as well as other feminization traits. Estrogen therapy for minors has always been uncommon and reserved for specific medical conditions, as hormonal treatments can have significant and long-term effects on developing bodies. Estrogens are FDA approved for use in minors under specific conditions, such as Turner syndrome and primary ovarian insufficiency, as well as for hormone replacement therapy, HRT. Turner syndrome is underdeveloped ovaries, so this only applies to females with ovaries. Again, primary ovarian insufficiency, or POI, only occurs in females. In this condition, the ovaries stop functioning normally before the age of 40, leading to low estrogen levels. And the last approved use of estrogens in minors is for females who have undergone oophorectomy or surgical removal of the ovaries, or with treatments like chemotherapy that impair ovarian function to restore normal hormonal balance and avoid long-term complications, such as osteoporosis. Estrogen therapy is also approved for use in minor females with delayed puberty if the delay is due to conditions like hypogonadism or other endocrine disorders. In a nutshell, I could not find one FDA-approved use for estrogens in male minors and only one use in adult males, which is for prostate cancer. For this reason, it appears that estrogens will not be allowed to be prescribed to males of any age without approved qualifying disorders. Now look at the male hormones. Could females of any age be legally prescribed testosterone? The FDA has approved testosterone therapy for females in one condition only, and that is limited to hypoactive sexual desire disorder or low sexual desire in postmenopausal women only. So that takes care of giving testosterone like hormones to any female that is not postmenopausal. Personally, I would never use testosterone to increase sex drive at any age due to the serious long-term effects. His Department of Education will be instructed that states and school districts that if any teacher or school official suggests to a child that they are trapped in the wrong body, they will be facing severe consequences, including potential civil rights violations for sex discrimination and the elimination of federal funding. As part of a newly credentialed body of teachers, we will promote positive education about the nuclear family, the roles of mothers and fathers, and celebrating, rather than erasing, the things that make men and women different and unique. The nuclear family is a family unit consisting of two parents and their children living together in a single household. This traditional family structure is often characterized by a married couple, though it may also include unmarried partners, and their biological or adopted children. The nuclear family is distinct from extended family structures, as it generally excludes other relatives, such as grandparents, aunts, uncles, or cousins, from the immediate household. So basically, Trump will require training for teachers about promoting the traditional family unit. Trump said that he will ask Congress to pass a bill establishing that the only genders recognized by the United States government will be male and female, and they are assigned at birth. This will also simplify language and communication about gender, particularly in public discourse, by reducing the range of terminology needed to recognize different identities. There will be he and she, him and her. You can still call yourself anything you want, but it will no longer place the responsibility and blame of knowing someone's gender identity on society. Recognizing only male and female genders is also consistent with the intent of the creator that designed two distinct yet symbiotic genders. As such, two genders reinforce the idea of a purposeful creation, where each gender has specific roles or complementary qualities. For some, this belief can bring a deep sense of order, purpose, and comfort. This reinforcement of gender definition within the law will solve many of society's ills. Title IX is a landmark U.S. federal civil rights law passed as part of the Education Amendments of 1972. It prohibits discrimination on the basis of sex in any education program or activity that receives federal funding. The law was written for two genders and will serve to remedy so many unfair policies that the left have taken towards transgenders in women's sports. Title IX is widely known for its impact on gender equality in education, particularly in the realm of athletics, but it applies broadly across all educational activities. The Biden administration sought to use the language of Title IX to include non-traditional new genders that have never been recognized scientifically. In April 2024, Biden's Department of Education released final amendments to Title IX regulations to enhance protections against sex discrimination in federally funded education programs to include transgenders. These amendments were scheduled to become effective in August 2024, but the implementation of the amendments has faced significant challenges. Legal disputes have arisen, with some universities, including Yale, remaining bound by earlier Title IX policies due to ongoing lawsuits. Additionally, a federal appeals court has been deliberating on whether certain provisions of the new regulations should be allowed to take effect, indicating ongoing judicial scrutiny. In many areas, the enforcement of Biden's new Title IX provisions remains suspended pending further judicial review. Trump has expressed intentions to roll back protections for transgender students and reverse the Biden amendments of Title IX in 2024. So Trump has said that he will reverse those amendments and will specify that Title IX protections will only apply to legally recognized genders of male and female. This will effectively eliminate men participating in women's sports. While Title IX currently only applies to students' rights, Trump has indicated that protections will be added for the rights of parents from being forced to allow their minor child to assume a gender which is new and an identity without the parent's consent. That means the school must do the job of teaching and will reinforce other measures that will prohibit teachers from teaching liberal transgender ideals to your children. I expect to see some refinements of these initiatives in the final laws that are enacted. But one thing is clear, and that is that Trump is focused on protecting children from the pressures of conforming to ideas that may be in conflict with their religious and moral beliefs. So tell me what you think. A copy of Title IX is attached in the description of this video for your review. Do you agree with the restrictions that Trump intends to enact on the transition of minor children?